Wallace, and I'm our team lead for the Immunization Delivery Science team here within the Global Immunization Division of the U.S. Centers for Disease Control and Prevention. Today, I'm going to be talking with you about building resiliency in immunization programs in the time of COVID-19 recovery. Essential immunization systems are defined as a comprehensive structure for ensuring that nationally recommended vaccines are delivered in a safe, accessible, and predictable manner to aware and engaged communities. National immunization programs are fairly complex structures with many different components such as program management, human resources, and at many different administrative levels, all the way from the national level down to a community level with health workers reaching out into the community to ensure high demand for vaccinations. Most national immunization programs were started around 1980, and by 2019, we saw global childhood vaccination coverage reaching 85% of all children worldwide, an incredible level of vaccination coverage. But in 2020, the COVID-19 pandemic caused major disruptions to health systems worldwide, including essential immunization systems. Childhood routine immunization coverage decreased from 85% to 83% globally. This decrease resulted in nearly 3.7 million more un- and under-vaccinated children, a 26% increase in the under-vaccinated in 2020 compared to 2019. And roughly 50% of all countries reported persistent disruptions in immunization systems all throughout 2020 into the end of 2021, increasing the risk of vaccine-preventable disease outbreaks. We also saw impacts on the numbers of countries that had planned to introduce new vaccines, such as HPV vaccine, the second dose of measles vaccine, pneumo and rotavirus vaccines, all impacting efforts to reduce childhood mortality and morbidity, and efforts to reduce the risk of vaccine-preventable disease outbreaks, especially for measles, which is one of the most transmissible of all infectious diseases. After the start of the COVID-19 pandemic, many countries put on hold mass vaccination campaigns for measles, polio, and other childhood vaccination programs because of concerns of potentially contributing to transmission of COVID-19 vaccination. Now, we've learned more and have guidance for conducting these mass vaccination campaigns in a safe and effective manner. However, many countries have still yet to complete those planned mass vaccination campaigns. And because of this, we now have wide immunity gaps across many countries, and you can see these laid out here on these maps. Now, in the early phase of the COVID-19 pandemic, what was put into place were known as public health and social measures, a comprehensive approach to mitigating the impact of the COVID-19 pandemic and trying to reduce spread of COVID-19 pandemic. These example public health and social measures, or PHSM measures, included social distancing, mask wearing, staying at home, closing non-essential businesses, doing remote working, canceling mass gatherings, including the canceling of the mass vaccination campaigns, for instance. Now, throughout that process, a number of countries began to move very quickly to support the development of a vaccine against COVID-19. Massive investments by a number of countries for this COVID-19 vaccine development throughout mid to late 2020. And by the end of 2020, we saw the first emergency use authorization given to a COVID-19 vaccine. And there were high hopes at the beginning that wide-scale COVID-19 vaccination would be the silver bullet to end the COVID-19 pandemic and reduce the need for these other PHSM measures that I talked about. Now, the introduction of the COVID-19 vaccine across the world has been a very impressive feat in terms of the rapid global rollout. It's increased coverage more rapidly than any new vaccine that's been introduced worldwide. And you can see this here on the graph. That's within roughly 6 months of the introduction of the COVID-19 pandemic, we were seeing global coverage reaching nearly 50%, which is an incredibly astonishing pace compared to the introduction of many childhood vaccines that you see labeled here on the graph as well. Now, as these introductions were happening for COVID-19, what we began to see were key hurdles emerging around both achieving high COVID-19 vaccination coverage, as well as having long-term immunity against COVID-19. We saw challenges with vaccine supply, especially for low and middle income countries. We saw an insufficient amount of funding available to cover all the vaccine costs, including for delivery and ensuring demand. We saw some of the strict cold chain logistic requirements being challenging for countries to implement. We saw individuals surrounded by misinformation about COVID-19 vaccine safety and effectiveness affecting demand. And then we had the emergence of variants that began to escape vaccine protection that resulted in the original vaccines being less effective than what we originally had planned and the need for introducing boosters. And then we saw the need for being able to ensure that we had a more comprehensive PHSM approach that included vaccination, but also included masking and the other original PHSM measures. And then we had a challenge too in many low middle income countries where the COVID-19 vaccine rollout really relies on the existing childhood vaccination program. And this has put quite a strain on many existing childhood vaccination programs to deliver simultaneously both the COVID-19 vaccine to the entire population, as well as trying to ensure that routine childhood vaccines continue to be delivered. And you can see here in this graph, just the relative volume of COVID-19 vaccine being distributed at the moment to try to get to a 70% coverage level by mid-2022, compared to how many doses we would typically be delivering for childhood vaccines. So roughly a six-fold difference there. And so you can imagine in a resource-constrained country that this is really putting quite a stress on the existing health system. So there's a real need for us to build resiliency within the essential health system, within essential immunizations, to help hold up the system to ensure that we are maintaining childhood vaccinations, that we are catching up children who've missed their vaccines for the last 2 years, to ensure that the COVID-19 vaccine rollout is successful, and also to respond to the vaccine preventable disease outbreaks that are increasingly being identified worldwide due to these immunity gaps that have widened over the last 2 years of constrained delivery for childhood vaccines. The Immunization Agenda 2030, which is the 10-year global plan for immunization programs, lays out 7 strategies that are used as a framework for how we manage, how we respond to, how we recover childhood vaccination programs worldwide. So let's walk through them. First, for strengthening of primary healthcare systems, what we want to do is revive routine immunization as a part of primary healthcare, to recover immunization and primary healthcare services and leverage these opportunities for the COVID-19 vaccine rollout to really more strengthen broadly the entire essential health system. For SP2, which is on commitment and demand, what we'd like to see is that there's demand generation for routine immunization in the midst of the COVID-19 vaccine rollout. For SP3, which is coverage and equity, what we'd like to see prioritized is that zero-dose children, which are children with routine childhood vaccines, are prioritized for recovery and strengthening of immunization programs. For life course integration, which is SP4, Strategic Priority 4, this is the area where we have a real opportunity with the COVID-19 vaccine rolling out to all individuals in a country to build out a country's life course approach to vaccination, as well as ensuring that a country has in place catch-up vaccination opportunities later down the road to ensure that they have this opportunity to catch up on earlier missed vaccines. For Strategic Priority Area 5, which is on outbreak prevention, there's a real need to reinstate all of those postponed mass vaccination campaigns and ensure that those countries that are considered to be fragile status are prioritized for essential immunization recovery. For supply chain and sustainability, which is SP6, there's a real need to adapt vaccine forecasting and assess global supply to ensure that there's fiscal prioritization of essential health services, including immunization, and ensuring that there's an efficient use of resources across both the delivery of COVID-19 vaccine as well as the strengthening of that underlying foundation, which is the childhood vaccination program in many countries. And then lastly, for SP7, which is research and innovation, we want to be able to leverage the innovations of the COVID-19 vaccine introduction towards the strengthening of routine immunization programs. So we have laid out at the global level a set of guiding principles for recovering, building resiliency, and strengthening of immunization in 2022 and beyond. The World Health Organization and partners have put together a draft document on these guiding principles. So I'm going to walk through them right now in terms of how we address the need to recover childhood vaccination programs. The first step is on implementing childhood catch-up vaccination guidance. Catch-up vaccination is defined as providing opportunities for children beyond that recommended age when they should be receiving a vaccine for a second opportunity to catch them up on those earlier missed vaccines. So this particular guidance was published in August of 2020 and lays out a number of catch-up vaccination strategies. These include intensified strategies to close immunity gaps, and so these can be one-time catch-up mass vaccination campaigns to reach those that have been missed during the COVID-19 pandemic, and also to ensure that immunization programs nationally, at a global level, but national immunization programs, introduce, if they've not already, routine catch-up vaccination strategies into their essential immunization program. These can be, for instance, screening at school entry, or ensuring that any child who's sick who comes in is also screened on their vaccination status. So we're catching those children in different key points to screen them on any earlier missed vaccines and then providing those missed vaccinations. Here's an example here on strategies to close immunity gaps, and this is on using campaigns to facilitate catch-up vaccination. In Mexico, Nepal, and Togo, they were able to utilize various different mass vaccination campaigns to identify and reach those children who had missed vaccination earlier on. And secondly, they were able to use these mass vaccination campaigns to also provide additional maternal and child health interventions that were also have been missed for the last 2 years. This can include provision of vitamin A, deworming tablets, or albendazole. And these are fairly easy interventions that are integrated into a mass childhood vaccination campaign and allow a child to get caught up not only on vaccinations, but also on these other key interventions. These are all of the VPD campaigns that have been postponed due to COVID-19. 35 campaigns postponed as of April 1st, 2022. So they're fairly wide-ranging. Most of them are measles campaigns, but there are other campaigns as well. So there's a real need for us to revive these postponed and or canceled immunization campaigns with an adjustment to those planned target areas and target age groups based on what's happened over the last 2 years. We also need to ensure that immunization programs address various restrictive policies and practices that hinder the ability to do good routine catch-up vaccination. One good example is the restrictive policies that some countries have on the maximum age limits for provision of routine childhood vaccinations. For instance, many countries only allow children to get vaccinated with routine vaccines up until 1 year of age. But in actuality, those children still continue to be at risk for those vaccine preventable diseases up to older ages, like say 5 years of age, and should still continue to receive a number of those vaccines per WHO recommendations. Now, this is the document on the guiding principles for recovery, building resiliency, and strengthening immunization in 2022 and beyond, and will be released on the WHO website sometime in the very near future. Now, there's a key opportunity here for leveraging the COVID-19 vaccine rollout to strengthen immunization in primary healthcare. There's many key challenges that have been laid out and documented by national immunization managers, such as with the COVID-19 vaccine rollout, including human resources being overstretched, the concerns about COVID-19 vaccine hesitancy spilling over to childhood vaccination. There's uncertainty about the future and whether the COVID-19 vaccine will be around in the future. But there's these key opportunities that national immunization managers see, which is around integrating COVID-19 vaccination into the existing healthcare system and being able to strengthen the existing vaccine cold chain system, strengthening disease and vaccine safety surveillance, strengthening social listening and communication capacities, strengthening information systems, and also being able to promote a broader immunization agenda, essentially an agenda around the life course approach to vaccination, thinking beyond early childhood. This is a real key opportunity here with the COVID-19 vaccine rollout that we can leverage. There's synergies as well that exist. We know that there's a lot of overlap in terms of the types of various different tools and strategies being used for COVID-19 vaccination that come from immunization programs, childhood immunization programs. This is just one example where the COVID-19 vaccine microplanning strategy was really based on the existing routine immunization microplanning guidance that comes from the Reaching Every District or the RED strategy guidance. And so these synergies here are really quite helpful, and one can strengthen the other across COVID-19 vaccination with childhood vaccines. There's also opportunities in strengthening the delivery of COVID-19 vaccine alongside other existing maternal and child health interventions. You see here examples from Sri Lanka of combining delivery strategies using the routine immunization sessions as an opportunity to screen parents for their COVID-19 booster dose status and then providing them that vaccination or motivating them to get vaccinated. And then in Bolivia, there's a strengthening of the vaccine safety surveillance system, not just for COVID-19 vaccine, but also for all childhood vaccines. Now, these synergies are real critical here, and there's a need for us to invest in additionally robust data systems, including the expansion of digital solutions and electronic information systems as one highly identified action that can add synergy between COVID-19 vaccination and routine childhood vaccine. So in conclusion, we've seen 2 years of strained health systems and disruptions due to COVID-19, and a real urgent need for us to close immunity gaps, recover immunization programs, and prevent risk of outbreaks by restarting those delayed those delayed childhood vaccination, mass vaccination campaigns, as well as integrating in routine catch-up vaccination strategies. And there's a goal for us to build back even beyond where we were in 2019. And we have this transformative opportunity to leverage immunization recovery and COVID-19 vaccination towards resiliency and strengthening of primary healthcare to leave no one behind across the life course. Thank you all very much, and I appreciate the opportunity to have presented to all of you today. Thank you.